In our morning rounds, new questions about the true healing power of medical marijuana. Doctors are allowed to prescribe pot in 23 states and Washington, D.C., but a groundbreaking new study challenges many of the health promises that came with legalization. Our Dr. Narula is here. Good morning.
Good morning, Charlie.
So what does it help and what does it not help and why?
Right. So this was really the largest, most comprehensive review of the safety and efficacy of medical marijuana. Researchers looked at 79 studies, over 6,500 patients. And what they found is that there was a moderate level of evidence to support using medical marijuana for chronic pain that comes with neuropathy or cancer and for spasticity associated with diseases like MS or multiple sclerosis. There was a low level of evidence for using it to treat things like sleep, anorexia, Tourette's disorder, weight gain and HIV, and nausea and vomiting with chemotherapy.
Why the difference?
Well, I think we don't really know. And that's really what this study highlights, is that there just hasn't been enough high-quality level evidence base to support any of this. We haven't had enough research. That's really where the problem lies.
So what are the side effects? And do you think that the positive outweighs the negative here?
Right. So certainly there are side effects. About over 80% of people in these studies reported side effects. Most of them were mild, like confusion, dizziness, dry mouth, sleepiness. But there's certainly concerns for more serious side effects, like cognitive effects, increases in anxiety or depression or psychosis, concerns on how it affects the developing brain in adolescence. And so, you know, we don't have enough long-term study of the effects of this.
But do you think positive outweighs the negative? Because the people who say they're being helped by marijuana certainly say, look, this stuff is helping me. It's
always a risk-benefit discussion when it comes down to any medication, and that's certainly the case with this one. And I think there are definitely people that this helps. And you know, it's a big dilemma right now, because you have the federal government basically still classifying this as illegal, as a Schedule I drug. So it's been very difficult to do research. You have the states legislating this through. So it's not going through the normal routes of being studied in the FDA. And who's in the middle? Doctors and patients. Doctors who are saying we need more evidence, who have patients who are suffering.
So the jury is still out in some ways. And then adding to the confusion, there was this new study that just came out that said edible marijuana is often mislabeled, right?
That's right. That's right. And that's a little bit alarming. You know, so basically researchers looked at over 70 products of edible type marijuana, and they found that only 17% were accurately labeled for the active ingredients. So 23% were underlabeled, 60% were overlabeled. So you really don't know what you're getting when you're paying for these products. But worse is that you could be overdosing. So if you're eating a marijuana brownie, how many brownies do I have to eat? I don't feel an effect. Do I eat 1, 2, 3? What other kind of medication do you go to the drugstore with and say, well, let me just take 1 pill, maybe I need 2, 3? You know, you expect accuracy and consistency.
So just as a doctor, since there are no real conclusive studies out there, why would you recommend it?
I think the big thing is, like I said, if you as a physician have ever treated a patient with intractable nausea and vomiting from chemo, with intractable pain, these are debilitating conditions. So yes, we're not giving something that's life-saving. And I think the argument for some physicians is, let's wait till we have more evidence before we put this out there, because we're not saving lives. But the other side of the coin is people are really suffering, and this offers them an option with a relatively reasonable side effect profile.
Interesting.